Hello, my name is Anthony. Today we'll be performing NG insertion. Today we have entered the client's room of Mr. Smith. Before entering the room, we have checked the doctor's orders. We are inputting an NG tube, and we've also made sure there is a chest x-ray ordered after the placement of the NG tube. We have gathered our supplies today. We have our piston syringe, our NG tube, our stethoscope, our pen light, tape, chucks, water filter cup, basin, and pH strip with our lube. As I enter into the room, I'm going to wash my hands, grab my gloves, and introduce myself to the patient. Hello, Mr. Smith. We check 2 identifiers, we make sure there's no allergies, and we discuss the patient, the procedure. Mr. Smith, today we'll be putting in an NG tube. You have a history of nasal problems, nasal surgeries, and or nasal occlusions or occlusions. We do an assessment of the nasals. We check to make sure there's no obstructions, inflammation, or any other issues. Check the back of the mouth, make sure there's no other issues as well that would stop it from going back down the throat. Alright. Breathe in, breathe out. Breathe in, breathe out. The better airflow, we're going to check that nasal and go with that one. Next, we're going to find the xiphoid process of the patient's chest, located at the bottom of the chest right here. I'm going to grab her and YouTube. We found the xiphoid process first because that's our measurement point. We're going to grab our 2 pieces of tape. One will be for our measurement, and the other will be for securement of the device to our patient. Before we insert the tube into the patient, we're going to move up to the high collars position to give us better access to insert it. So Mr. Smith, through this procedure, we're going to insert this tube through your nose. You're going to swallow through it. I'm going to give you a little bit of water. And as it goes back down through your mouth, you're going to tuck your chin to your chest, and you're going to keep on swallowing through. I'm going to provide the patient with a basin in case he decides to throw up. The water's here. And now, you're going to measure our NG tube. This is a clean process. So we're going to measure from nose to ear, then ear, the xiphoid process, which will be right through here. We take that first piece of tape and tape it right here. And this is how far down the NG tube should go for the patient. So we're going to place this right here, and we're going to get the patient ready for insertion. We're going to place a chuck in the patient's chest for this procedure, just in case he does gag, vomit, or any other issues. We're going to set up our pH for afterwards, after insertion. We're going to put our piston syringe for post-insertion to 15 cc's. And our patient our water cup in his free hand. And grab our lubrication. We're going to open it, lubricate our NG tube up. We're going to explain one more time to the patient what we're going to do. Alright, sir. What we're going to do now, we're going to place this NG tube right in through your right nasal. What you're going to do is when I say swallow and tilt, you're going to swallow and then tilt your chin to your chest and go through, okay? We're going to insert on 3. 1, 2, 3. We inserted. Alright. Tilt your chin to your chest. Swallow. Swallow, 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 swallow. Swallow. Okay. Okay. We get all the way up to the tape. And then we're going to take this right on through. Next, we're going to check placement of the NG tube. We're going to use the bigger tube here. We're going to use our stethoscope. The first test we're going to check for is the swoosh. Using 15 cc's of air, we're going to come right above the belly button and right below the xiphoid process. Listen for a swoosh, which we have heard. Next, we're going to be checking stomach pH. We're going to grab about 15 cc's right from the stomach. And from our pH card, right through here, we're going to use this stomach gastric content, place it right here. And finally, our third and final test would be our chest X-ray, which we'll be looking for the placement of the tube right through here to make sure it's not in the lungs or anywhere else besides the stomach area. Our final part would just be clean up. We would attach this behind the ear or somewhere comfortable from the patient, provide him back to his gown, and dispose of any products. And that concludes the NG insertion.